If you are like most people, you may not realize that there are many choices available for people to prevent HIV. One highly effective method is PrEP, short for pre-exposure prophylaxis. Hello, you are watching The Last Mile with NACA. I am Adesa Walsui. Welcome. In this episode, you will get to know more about pre-exposure prophylaxis, who it is meant for, and how it works. Keep watching.
Pre-exposure prophylaxis, or PrEP, an antiretroviral medication, has emerged as one of the most effective ways to prevent HIV infection. If taken as prescribed, PrEP drugs can reduce the risk of getting HIV by upwards of 90%. The medication must be taken before any risky exposure to the affected. Before beginning to take PrEP, a HIV test should be done, as PrEP is not to be used by HIV-positive individuals. HIV PrEP is recommended for individuals who belong to a higher risk group and who do not have any current established HIV infection. HIV high-risk groups may include someone who has an HIV-positive partner, someone who has multiple sex partners, men who have sex with men or transgender, sex workers, and someone who injects drugs.
Pre-exposure prophylaxis are drugs that are meant to prevent HIV infection, especially for people that are at high risk of acquiring the infection. These are couples that are discordant, where one person is HIV negative and the other person is HIV positive. To prevent the partner from acquiring HIV, these drugs are made available. When they are taken, even in the event of a risk of transmission, the transmitted virus will not be allowed to proliferate and set in infection. And the second group for which it is mostly now used and available are the key affected population who are at higher risk of acquiring the disease and also at high risk of transmitting the disease to other people.
Reaching Impact, Saturation and Epidemic Control, RISE, a global project funded by the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and the U.S. Agency for International Development, USAID, aims to achieve a shared vision of attaining and maintaining HIV epidemic control.
The RISE project is actually Reaching Impact, Saturation and Epidemic Control, and the project is funded by PEPFAR through USAID to ensure that we reach out to high-risk individuals as well as also support clients who are positive to be on medication, and also ensure that we achieve viral suppression to achieve full epidemic control. And one of the ways we feel we can achieve epidemic control of HIV is through PrEP. That means as a form of primary prevention of HIV. So it's actually targeted for the HIV negative individual so as to prevent them from getting infected with HIV.
How does PrEP work? When a person starts taking PrEP, the drugs reach high concentrations in the places where HIV can enter the body, such as the bloodstream, genitals, and rectal tissue. The drugs prevent HIV from making copies of itself in CD4 cells. Since HIV cannot replicate, the immune system can clear it from the body, preventing a permanent infection. There are systematic barriers to PrEP usage, including awareness of PrEP, perception of HIV risk, and stigma.
People see PrEP as ART. That's because they fall under the same family of ARVs, that's antiretrovirals, and they are likened to ARTs, that's antiretroviral therapy, which is used for treatment of HIV. That's for HIV positive individuals, right? And it creates what is called the PrEP stigma, especially in the community where even HIV positive stigma is already enshrined or already there. So it decreases the demand for PrEP because they see PrEP as people taking PrEP as promiscuous, rather than see it as a good health-seeking behavior, knowing your risk and knowing how the possibility of being infected and not trying to take charge of your life and your health, and by ensuring that you're on PrEP to prevent HIV. So that's one major problem we have. But secondly, we know that even as we speak, PrEP is not really everywhere the way we know HIV is, right? So one of the things we want to, or we hope this medium will try to do is try to advocate to see how we can get, let me use the term, the gospel of PrEP to every nook and cranny of the country as a way of achieving epidemic control.
At the moment, it's not as accessible as the conventional HIV drugs we give because the cost is a little bit prohibitive for the donors. We get these drugs mostly as donations, but they are at the moment given at one-stop shops. These are places where key affected populations are seen and are provided medication for those that have the disease established, and pre-exposure prophylaxis for those that are at risk of acquiring the disease, especially those of them that are HIV negative. For other places where we provide medication, there is an ongoing review of the guideline by the WHO. Hopefully after that review, the cost may be less than what it is at the moment, and probably at that time the donors may find it feasible to make money available so that this medication could be available at open markets for people to access.
Collaboration among stakeholders is crucial to increase awareness and demand of pre-exposure prophylaxis.
RISE and FHI EPIC were working together with NACA and as well as NASCAP, that's the government organizations, to further first to develop a framework for implementation of PrEP, national implementation plan. We also looked at some training manuals for healthcare workers. We're also looking at, especially from the RISE end, we're looking at a subset, that's a subpopulation, being the AGYW, that's adolescent girls and young women, who we know, according from our data, are actually the ones in who we need to create more demand from, because our data have actually shown that they have less demand for them. Like a sex worker who I'm sure will be within the AGYW population, who cannot take PrEP because of the stigma associated with it. What we try to do is to create that demand and make them understand that PrEP is supposed to be a good health-seeking behavior. And we are trying to change that narrative in collaboration with the government to see how we can improve the demand for PrEP in that subpopulation, as well as other the key populations that would really need PrEP.
PrEP is not to be seen as a standalone, but should go alongside other prevention packages.
There's what we call risk compensation. PrEP is supposed to be given in combination with other prevention packages like condom, which come under the biological interventions. Also, we also look at the voluntary male medical circumcision, right, as also a part of the prevention package. We also look at the behavioral package as well, because for everybody who comes for PrEP, as well as other prevention package, you also want to counsel them appropriately and about risk. You want to do their risk assessment, and you want to know, once they are high risk, you also want to counsel them about risk reduction strategies. So PrEP is not just given in isolation, it's given together with these other packages.
NACA is in constant dialogue with the donors to ensure availability and affordability of PrEP in Nigeria.
We are working with the donors, and we're talking to them, and we're looking at the work WHO is currently doing. And we're hoping that very soon these guidelines will be available for everyone to use. And for donors who feel uncomfortable about the prohibitive costs, will now find it more feasible to support our programs nationwide, especially in the areas where we want to make pre-exposure prophylaxis medications readily available and accessible.
Since PrEP only protects against HIV, condom use is still important for the protection against other STDs, or if PrEP is not taken as prescribed. For more information on PrEP, call the National Call Center on 6222 toll-free.
We all know festive period is a time to loosen up. We all have fun, lots of hangouts.
However, statistics show increased indiscriminate sexual activities over the holiday period.
Unfortunately, this also means more people are getting sexually transmitted infections.
One gift I will never love to get during this festive season is that of HIV infection.
So, celebrate this holiday responsibly and with caution.
Avoid anything that can lead to new infections, impacting the progress made in the fight against HIV and AIDS.
Your New Year resolution should include knowing your HIV status.
Get tested for free today.
Bruv, babe, share love and not HIV infection.
The update segment brings you a highlight of NACA's activities across the country and elsewhere. Don't go away.
The need to track collective progress made towards achieving set global goals in the HIV and AIDS, tuberculosis and malaria response by various stakeholders cannot be overemphasized. Hence the creation of the Civil Society Organization Accountability Forum. The 7th edition was a 3-day event held in Abuja with the theme Protecting the Gains of HIV, TB and Malaria Response in Nigeria within the context of COVID-19, and had in attendance representatives from the National Agency for the Control of AIDS, NACA, National AIDS and STI Control Program, NASCAP, USAID, UNAIDS, PEPFAR, among others. Representing the Director General, NACA, the Director, Policy, Planning and Coordination, Dr. Adefunke Oki, highlighted some of the achievements of the agency in protecting the gains of HIV within the context of COVID-19.
When the COVID-19 epidemic broke out, we got partners together using our expanded theme group platform at NACA. And we said, the people living with HIV and AIDS would need some support. So at NACA, we set up what we call the UN Basket Fund, where all the UN partners put money on the table. And we're able to use those resources to help many states. We actually did some cash transfers. We provided, face masks, sanitizers, and we encouraged the states to do whatever they could within their power, mobilize resources to help the people living with HIV and AIDS in their states. Then, in addition, for every program that we have, we ensure that COVID-19 regulations are closely followed.
There were also presentations from representatives of UNAIDS, the Nigerian PEPFAR coordinator, NASCAP, and the program manager, Country Coordinating Mechanism to Fight AIDS, Tuberculosis and Malaria.
We are aware that NASCAP coordinates the health sector response, and the health response was one of the most hit, and we had to spring into action. There was a committee set up, and we had to have a user's guide on the effects of COVID-19 on the HIV program. So using the guideline as a guide on what we're expected to do, there was the infection prevention control plan that was in place, that all health facilities were asked to install points to wash their hands, make use of face masks and gloves. That was in place. There had to be staggered schedules for healthcare workers to reduce the amount of people in the facility at once. They had to also stagger the appointments for PLHIVs to reduce the waiting area and contacts of PLHIVs. So these were measures that were put in place.
For those of us that know malaria very well, there is what we call mass campaign. The mass campaign before now is usually done through a center in a community. Then people will come, assemble, and take the net. But we engage community volunteers to move to those areas, and they will take the nets door to door. So these are things that we are investing in to make sure that the gains in type of malaria, for example, reduction from prevalence from 42 to 23, we want to reduce it further, and we can only get that done with the support of the community.
The CSO Accountability Forum was highly interactive, as participants asked salient questions that were duly answered by representatives of the various organizations present.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
The Director General for the National Youth Service Corps, NYSC, Brigadier General Shuaibu Ibrahim, and his team recently paid a courtesy visit to the National Agency for the Control of AIDS, NACA, at their headquarters in Abuja. The Director General, NYSC, Brigadier General Shuaibu Ibrahim, stated the purpose of their visit.
The DG and NACA management donated 72,000 RDT test kits to corps members for the forthcoming orientation course. And without these items, I don't think we would have been able to open our orientation camp. They have to be here physically to thank him. I also appreciate what NACA is doing. Our partnership, I can assure, will continue to go from strength to strength. We have a CD group for NACA, and I'm highly impressed from the brief I do get from the Director of Community Service of the tremendous support NACA has been giving to this group, and the corps members are also doing wonderfully well in sensitizing Nigerians on HIV, AIDS, and so on. So I want to assure you that more of these corps members will be made available for you, so that we continue to partner with you and see how they can continue to sensitize Nigerians and educate them.
Welcoming the NYSC DG and his team, the NACA chieftain, Dr. Gambo Aliyu, commended the NYSC for the discipline instilled in the corps members, stating that the ones posted to the agency have been hard-working and diligent. He also gave statistics of HIV prevalence among different groups.
Recently, NACA released a study we did, and this study was done in terms to look at where is this epidemic raging. We know HIV has since been found to go fast, among the gay community people, people that inject drugs and the rest of them. But who additional new members in the community are driving this disease that we don't know, because, our program is supposed to be data-driven. It's supposed to be informed by the information that's going out there, going on there. And you know, one thing that we found surprising is that unmarried people that are younger, between the age of 22 to 25, are now the ones that are spreading the virus among them. So these guys are not taking protection measures. And if you look at the NYSC age range, you find out a lot of them are in that group. And we've been working with NYSC for quite some long time, but I think this is the time when we need to have a renewed vigor where we work together and implement programs not only in the general population but within the NYSC circle.
Effective collaboration is key in winning the fight against the HIV epidemic.
They go like this now. Take am easy now.
Now hospital I dey go to do HIV test.
Now everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Now make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes, so during pregnancy or labor, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate against persons living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Ade Suwalsi. Goodbye.